Hey guys, we're back for another conversation with Kenna today, and the topic is going to be shock. So here we go. Conversation loading. All right, Kenna, I know shock is an emergency in both canine and feline patients, but what's the difference between a cat and a dog in shock?
Great question. Dogs and cats can both go into shock, but they often present differently, and treatment needs can differ too.
Hmm. How do dogs usually look in shock? Like, how do they present?
Dogs with shock often show the classic signs: fast heart rate, weak pulses, pale gums, prolonged CRT, cold limbs, and low blood pressure. They're usually trying to compensate by increasing their heart rate.
Hmm. So, tachycardia or increased heart rate is common in dogs?
Exactly. A dog in shock is often tachycardic unless they're very late stage shock or have another condition affecting their heart.
Hmm. What about cats?
Cats are usually trickier. They may not show the classic dog signs. Instead of a fast heart rate, cats in shock can have a normal or even low heart rate. That's why shock in cats can be easier to miss.
Whoa, okay. So, a cat in shock cannot be tachycardic?
Yes. Cats often compensate differently. They may present with hypothermia, weak pulses, pale gums, mental dullness, and even bradycardia.
Whoa. So, why does that happen?
Cats tend to decompensate faster and can have a strong vagal response or poor ability to maintain compensation compared with dogs.
Oh, does the fluid therapy that you give each of these patients, first dogs and cats, differ also?
Mm-hmm. Definitely. Dogs often tolerate larger shock boluses better. For dogs, we may give a larger fluid bolus and then reassess parameters.
And what about our feline friends?
Cats usually need smaller, slower boluses with frequent reassessment because they're more prone to fluid overload and may have hidden heart disease.
Oh, okay. So, moral of the story, we have to be more cautious with our feline patients.
Exactly. With cats, think careful fluids, warming support, and close monitoring.
Okay. What about the different shock organs I've heard about versus canine versus feline?
Great point. A shock organ is the organ system that tends to show injury first or more obviously when perfusion is poor.
Okay. So, what's common to happen in dogs? So, what's the shock organ with that species?
In dogs, the GI tract is a big shock organ. Poor perfusion can lead to vomiting, diarrhea, ileus, GI barrier damage, and bacterial translocation. The kidneys are also very vulnerable, so we watch urine output closely.
It's a good point. Good point. So, dogs may show GI signs during or after shock?
Exactly. They can also develop elevated lactate and kidney injury if perfusion stays poor.
Oh, okay. So, what about cats?
In cats, the lungs are often considered a major shock organ. Cats are more prone to pulmonary edema, respiratory compromise, especially if they receive too much fluid or have underlying heart disease.
So, the respiratory rate and effort in cats matter more, or we should keep an eye on that a little bit more in felines?
Huge priority. Cats that are in shock, we watch their breathing very closely. Cats can also have kidney injury, hypothermia, and rapid cardiovascular collapse.
Hmm. So dogs equal watch the GI tract and kidneys. Cats equal watch the lungs and perfusion.
That's a good practical summary. Both species can affect any organ, but those patterns help guide monitoring.
What should we monitor in both?
Mentation, TPR, blood pressure, urine output, breathing effort, any significant changes in blood work like PCV, lactate, and VG.
Oh, so what's the big takeaway here?
Dogs usually show obvious hyperdynamic shock signs like tachycardia and may have GI complications, while cats may look quiet, cold, and bradycardic with lungs that can become a major concern.
Okay. I'm gonna go like this, like you. Um, so that's good to know. So never assume a calm cat is a stable cat, right?
Exactly. In emergency medicine, that quiet cat can be the sickest patient in the room.
Wow, Kenna, thank you for all the information today. Great job. Episode down. Bye, guys.